Happening now, a new 20-year study, actually 23 years, adding fuel to the debate over prostate cancer treatment. Now, researchers from Sweden and the Harvard School of Public Health finding that 18% of men under 65 who had their prostate surgically removed were less likely to die of their cancers compared to 34% who were not treated unless the cancer progressed. It's a strategy called watchful waiting or active surveillance. Dr. David Samadi is chair of urology at Lenox Hospital, professor of urology at Hofstra Northshore, LIJ School of Medicine. And, you know, this is what you do. And this is huge news, isn't it?
This is a big deal. We've been waiting for this news for almost over 2 decades. And until now, watchful waiting was always ahead. And it's also more popular because people want to hear that, you know, you don't need surgery, you don't have to have the risk of the surgery. But this will tell you, and I hope this will put it to stop, and people realize that surgery for prostate cancer, certainly under the age of 65, is absolutely superior to this watchful waiting. And over age of 65, it reduces the risk of metastasis or spread of the cancer. It's a huge news, Greg, coming out of New England Journal of Medicine.
Let me ask you this, because some people are critical of prostate surgery because it allegedly has debilitating effects over the rest of the lifetime of the patient. But maybe we need better doctors.
Well, that's well put. I think experience matters. And just to say that surgery means incontinence or sexual dysfunction, that's absolutely incorrect. We just need to find better surgeons, more experienced surgeons, people that are dedicated to this field, and that's where you need to be. But you should get the cancer out. Longevity and mortality is much less. People live longer as a result of surgery. And when the cancer spreads, the quality of life is a nightmare. What I like about this, Greg, is the fact that the study was randomized, something that we may not be able to do in the U.S. You can't tell one guy we're going to do watchful waiting and another one. So they did it. It's randomized, 23 years of follow-up. Great study, and it just tells you that surgery is superior than watchful waiting.
Yeah, you got to keep an eye on your PSA. I mean, you got regularly have that tested, but you do robotic surgery, right?
That's right.
And you're at the top of your field, highly regarded.
Thank you.
I mean, robotic surgery is really the way to go?
So, look, I would say that in the hands of, again, it's your experience. Who is the person behind these robots? This is what I do day in and day out.
Right.
I also protect my patients, meaning that there are people near where I work that may run 2 or 3 rooms at the same time. I think that's bad medicine.
Right.
One patient at a time, one surgery at a time. You need to be a good oncologist. If you have all of those qualifications, 95% continence, good sexual function, it's the way to go, and you have to take care of them. Look, the other thing is that men also are living longer because the heart disease have gone down. So if they're going to live longer, we have better quality surgeons, get the cancer out, and no more watchful.
Well, you're the best. David Samadi, good to see you.
Good to see you.
You know, congratulations. This is big news in your field, long awaited. All right, Jenna?